Mark Bishop Show. Truly like a box of chocolates. You never know who you're going to meet. From business, lifestyle, and fun. Here's Mark.
You know, folks, January is Birth Defects Awareness Month. And when you have 1 in every 33 babies born with a birth defect, who's helping with this? Who's doing what? Scott Adzick, MD, Surgeon-in-Chief, Children's Hospital of Philadelphia, known as CHOP, and founder and director of CHOP's Richard D. Wood Jr. Center for Fetal Diagnosis and Treatment. It's nice to have you back on the show, Scott.
My pleasure, Mark. Thank you very much.
Well, my friend, each year, nearly 150,000 babies are born in the United States with birth defects, many with conditions so rare that most parents and even some clinicians have never heard of them. So, I certainly won't ask you how common are birth defects, but it's pretty bad, isn't it?
It is. So the big view on birth defects, now that it's topical with January being Birth Defects Awareness Month, is that birth defects are common. In the U.S., 1 in every 33 babies is born with a birth defect. And birth defects as well are costly. Billions of dollars are required for medical treatment. Birth defects are also merciless. No parent is immune. They're mysterious. Most causes of birth defects are unknown. They're overlooked, in my view. Research, I believe, is underfunded. And most importantly, serious birth defects are deadly. They're the leading cause of infant mortality. So birth defects are a big deal.
Yeah, well, for thousands of these babies, fetal surgery can mean the difference, right, between life-threatening complications and the chance for a healthy future, correct?
I think so. I mean, we've been doing this here at Children's Hospital of Philadelphia, or CHOP, for more than 30 years. We've been lucky to pioneer groundbreaking fetal surgical techniques to treat many different birth defects. We're home to the Garvos Family Special Delivery Unit, the world's first birth facility exclusively for mothers carrying babies with birth defects. We are lucky to have an enormous clinical volume since 1995. More than 35,000 mothers carrying babies with birth defects have come to us for care from 50 states and from more than 70 countries. And yes, there are certain conditions, birth defects, that cause progressive organ damage before birth. If you wait until the baby is born, you're too late. So that's the rationale for doing fetal surgery, and I can give you a couple of examples if you like.
Sure. I mean, I was just going to say, too, that your center recently celebrated their 30th anniversary. Some big breakthroughs you got to talk about a little bit later, but by all means, please go ahead there.
Yeah, see, you're right. So experience is important. So 2 of the most common birth defects that we treat at CHOP before birth. First is spina bifida. So what is that? Spina bifida is a birth defect where the spine and spinal cord don't form properly, leaving a gap or a hole in the backbone that leads before birth to exposure of the nerves to neurotoxic amniotic fluid and nerve damage and mobility problems and hydrocephalus and fluid on the brain and brain damage. And these are the kids who are, if they're not treated before birth, they're the wheelchair-bound kids. They require a shunt tube to treat hydrocephalus. And if we fix this before birth, properly selected patients, usually at 23 to 25 weeks gestation, where term is 40 weeks. So at that 23 to 25 weeks, the fetus is about the size of my hand. If we do the repair for birth, having done the first one in the world in 1998, we're about to do our 500th fetal surgery for spina bifida here at CHOP. That leads to much better outcomes, much more likely chance the child will be able to walk, not need a shunt tube or hydrocephalus, and so forth. So that's one example. Another example, I do about 100 of these fetoscopic laser cases for what's called twin-twin transfusion syndrome, or PTTS for short. That involves identical twins in the uterus, of course, separate amniotic fluid sacs. And the fetus almost invariably, of course, has its own placenta, which is a disc that the umbilical cord goes into for blood exchange and nutrient exchange with the mother. But for this condition, the identical twins share a placenta, and it's shared unequally, such that one twin gets too much blood from the mother, goes into congestive heart failure, has an increase in amniotic fluid. The other twin doesn't get enough blood, goes into kidney failure before birth. and is shrink wrapped because it can't produce any fetal urine or amniotic fluid. These twins will go on to die almost uniformly unless we do fetoscopic laser therapy. So what is that? So that involves putting a tiny fetoscope through the mother's abdominal wall. It's about 2 millimeters in diameter, the fetoscope, through the uterine wall into the uterus, visualize the single placenta, and then use a laser fiber, photocoagulate or occlude the unpaired blood vessels going from one side of the placenta to the other. The results are greater than 90% cases, both twins are saved. So that's quite a dramatic
Isn't it?
outcome.
That's amazing. It sounds miraculous. But, you talked about experience before. I mean, Dr. Adzick, approximately 5,000 fetal surgeries done worldwide, right, to treat these birth defects. And a whole quarter, have been performed at CHOP, which is regarded as one of the top-ranked and largest children's hospitals in the U.S. In fact, each week at CHOP, highly sophisticated fetal surgery teams repair birth defects in the womb, place fetal shunts to treat life-threatening congenital conditions, or perform minimally invasive procedures in the mother's uterus. So I think it's, it can't be underestimated what experience is, what it means. Where's the future? Are there enough coming out, trained, qualified, as good as you in the future?
Well, one of our obligations is to train others. And so many centers in North America, South America, Far East, Europe, England, have been trained here at CHOP. So that's good because it spreads the availability of this technology and these diagnostic and therapeutic techniques around the world. For the future, there's a lot going on. That future is very, very bright, and I'll just touch on
Sure.
three
Yeah, that's
areas.
exciting. Yeah.
One is in utero gene editing. Treat before birth using CRISPR technology, single gene disorders that cause conditions such as sickle cell anemia, cystic fibrosis, muscular dystrophy, a whole list of things that can now routinely be diagnosed by 12 weeks gestation. Dr. William Pronto is a pediatric surgical scientist and fetal surgeon who is doing this work experimentally in animal models. He has proof of principle that this works. This will be applied eventually clinically, and when it does, it'll affect and cure thousands and thousands and thousands of unborn babies with these single gene disorders. So that's the first area. Second area, Dr. Alan Flake, also a pediatric surgical scientist and fetal surgeon, has been working for 9 years, mostly working in fetal sheep, on the artificial womb. So what would that be used? How would that work? Well, babies born at 23 to 25 weeks gestation have a very high mortality rate, and if they do survive, a very high complication rate. The artificial womb, using the umbilical vessels and in a uterine-like environment, and fetal sheep can provoke normal development for 3 to 5 weeks, and we can do that clinically and get the babies out at 30 weeks gestation. Say it's dramatically improved not only survivals but decreased complication rates. So Dr. Flake and his team have an FDA fast track to get this to clinical application, and we hope to begin to apply this in the clinical trial by the end of this calendar year. Third area involves big data and artificial intelligence. We created the Clinical Outcomes Data Archive, which the acronym is CODA, C-O-D-A, first of its kind database that combines real-time medical records with carefully reviewed clinical information to improve prenatal diagnosis and care. So since 2013, this CODA has tracked every mother, every fetus, treated in CHOP's Center for Fetal Diagnosis and Treatment, now holding more than 15 million data points from over 15,000 patients to help clinicians make earlier, better informed decisions. So how is this being applied? Well, one way it's being applied is with our neonatology group led by Dr. Natalie Rintoul at CHOP for the delivery room of the future. Using the CODA, we can help manage, particularly in the golden hour, the first hour after birth for a baby with a very serious birth defect, to optimize care management, decision-making based on that fund of knowledge and artificial intelligence. So that's very, very exciting.
Yeah. lot of good things. Amazing. And I hope that a lot of this stuff is explained on your site for listeners to go to and have a good look. Fetalsurgery.chop.edu. Is there good information there for them?
I think so.
Okay.
There's abundant information, much more than I can explain in 10 to 15 minutes. Fetalsurgery.chop.edu.
That's the
CHOP
one.
stands for Children's Hospital of Philadelphia. Yep.
Yeah, that's the one. Fabulous work, and you're doing great work. And I've heard a lot about CRISPR technology, but of course I was going to ask you anyway, the advent of AI, how's it helping you now? How's it specifically, getting in there? And, well, you answered that. You know what? It's always interesting to hear from you. Dr. Scott Adzick, medical doctor, of course, surgeon-in-chief of Children's Hospital of Philadelphia, infamous CHOP, they call it, and founder and director of CHOP's Richard D. Wood Jr., the Center for Fetal Diagnosis and Treatment. But remember that, folks, please, fetal surgery, one word, one sentence, fetalsurgery.chop.edu. Thanks, Doc. Catch up later on, okay?
Thank you. Okay, bye-bye.
Bye-bye.
Join us again for another episode of The Mark Bishop Show. It's a production of Mark Bishop Media.